Good afternoon. This is David Fernandez. Sorry. This is David Fernandez. Hi. With Anatomy and Physiology. This is for the new discussion board number 6. This is tying it all together. My case study was ECT for Parkinson's. And unfortunately, my microphone for my laptop is absolute garbaggio. So I had to do it via YouTube. So please bear with me. Here we go. This is ECT for Parkinson's, electroconvulsive therapy, an effective tool to combat Parkinson's disease associated psychosis. To introduce the condition, Parkinson's disease brings along with it heightened psychoses. So they are usually given pain meds, or they're given normal medications to help combat these psychotic episodes. And for the most part, they usually work, but in a lot of instances, they unfortunately just don't do enough. So without further ado, we move on to the dilemma. The dilemma was, as you could read, this is a 42-year-old male. He has been married to his wife for decades at this point, and he was given Parkinson's disease, or PD, medication. So this was to help control his trembling. This was to help control his pain, and this is also to help control his psychosis. Unfortunately, the medications that he was given was not enough. So the dilemma actually became that he was becoming a danger not only to himself, but to his entire family, his wife primarily. He was thinking about murdering her because of the vivid hallucinations that he saw with her having sex with another person on his bed with him lying next to it, which obviously did not occur, in real life. It's just that with his psychosis, it was vividly real to him. So obviously something had to be done. That was, in fact, the dilemma. So we move on next to the diagnosis and treatment. So he was evaluated and diagnosed again, and he was diagnosed as a PD-associated psychosis. He was rated by the Hoehn and Yahr scale, the HYS scale, the PANSS scale, which is the Positive and Negative Syndrome scale for schizophrenia, and he was also on the BPRS scale, the Brief Psychiatric Rating Scale, and he tested positive for psychosis. So his doctors treated him his treatment would entail the normal meds that he was usually taking, as well as electroconvulsive therapy. And it was just over 5 sessions total. It was administered every other day, and they were just waiting to see what the results would be. They had hoped that this would help him and help curb his psychosis, and at least his psychotic episodes, or his hallucinogenic episodes. So, moving next, the results. His psychotic signs vastly improved, and it seemed to work very well for him. It obviously didn't cure his Parkinson's disease, but at least for the psychotic episodes that he would have, they were greatly reduced and almost completely neutralized, which was a success. Very good. And months after the fact, he was still doing just as well as when he completed the sessions to begin with, which proves that this, at least in this case, that the electroconvulsive therapeutic sessions were a great help to him. So, after the results, let's see. Yes, this is the website for the case study that I had, and obviously you could see some of the little memes I put in just for a little bit of humor. Parkinson's disease is no joke, unfortunately, but it is nice to see that there is improvement, even if it is small steps. At least it's in the right direction, in the proper forward direction. I want to thank you all for bearing with me through this. I appreciate it, and I'm very grateful for you guys watching my video. I will hopefully watch all yours too. So go easy on me, I'll go easy on you. You all take care. Have a great weekend.